Welcome, everyone. Hello. Welcome to Insights on Innovation for Self-insured Employers. My name is Steven Collens. I'm the CEO of Matter. Matter is a healthcare incubator and innovation hub built on a belief that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. Today, I am delighted to present a program that we've developed together with one of our partners, Livongo, which recently merged with Teladoc. It is the first program in a series that we are producing together, Insights on Innovation for Self-insured Employers. The premise as we develop this series is as follows. The collection of those who have responsibility for the health and well-being of people in the US include healthcare providers and insurance companies, individuals themselves, obviously, and employers. But employers as a segment frequently don't get as much attention in the world of healthcare technology innovation as the others. The reality is half of the US population receives health insurance through their employers, and roughly 3/4 of those receive coverage under a self-insured employer plan, which means those companies are bearing much of the risk associated with the health of their employees and their families. So whether they like it or not, US employers are healthcare companies. Even before the pandemic, self-insured employers were seeking ways to improve the health of their employees, and that trend has accelerated this year. And this series that we're kicking off today is designed to help employers further advance their healthcare innovation strategies. At each program, we will bring together employers and market disruptors and other experts in the field to discuss strategies for innovative cost containment and health improvement. And we'll look at the technologies and processes being implemented to enable these advances. We are kicking things off today with an all-star cast. First, we have Jim Winkler, the Senior Vice President and Global Chief Innovation Officer of Health Solutions at Aon. As the global innovation leader for Aon's Health Solutions business, Jim has responsibility for developing and implementing leading-edge solutions that enable employers to improve health and manage costs. As you'll see, his breadth of clients gives him a broad perspective that he will share today. Next, we have Jason Parrott, Senior Manager of Global Healthcare and Wellbeing Strategy for Boeing. Jason is also the chairman of the board for the Midwest Business Group on Health and a board member of the Employer Health Innovation Roundtable, the Integrated Benefits Institute, and the Pharmacy Benefit Manager Institute. Boeing, you'll note, has a thing against webcams, so you will have to imagine what he looks like. Finally, we have Glenn Tallman. I never know exactly how to introduce Glenn because he's built so many successful companies, but for today's purposes, I will just say that he is the founder and former executive chairman and CEO of Livongo and co-founder and managing partner of Seven Wire Ventures, a healthcare-focused investment firm. Most importantly, of course, he serves on the board of directors of Matter. I'll be guiding the conversation today. If you have questions you'd like to ask any of the panelists, please use the chat function and I will incorporate them as best I can into the conversation. And just one final note before we get started. For those of you who signed up for the post-event networking, you'll receive an email in a bit from Kay Nietzkaj in a few minutes that will include a separate link to click on at the conclusion of the main program. With that, let's jump into the conversation. And Jim, I will kick things off with you. Awesome. What trends were you seeing pre-pandemic with your clients, with self-insured employers who are kind of looking for technologies to improve health and control costs, and what's changed?
Well, so pre-pandemic feels like an eternity ago, right? But it really was less than a year. At the time, you go back to earlier this year, right? We had an incredibly tight labor market. So organizations were very, very focused on how does my health and well-being strategy allow me to attract, retain, and fully engage a really compelling workforce, right? And so Absolutely a focus on improving health through holistic well-being, and using your resources efficiently so that you could do more within the broad context of your total reward strategy. As the pandemic unfolded, obviously, organizations went pretty quickly into sort of, I'll call it reactionary crisis mode, right? How do I quarantine people? Should I be doing temperature testing? When can I reopen my office? What do I do about accessing testing? All of those kinds of things. And in doing so, I think our employer clients were consistently looking at the marketplace to see how the array of digital health solutions were going to pivot or transform themselves to serve the needs of employers in the midst of this crisis, right? So we saw organizations that were, sort of near site primary care clinics, right, which was a convenience play pre-pandemic, turn themselves almost overnight into PCR testing centers. So we saw things like that play out where the marketplace responding to the crisis pivoted, and our employer clients really, really welcomed that. And we're still sort of in that mode now, right? Getting ready for probably a similar pivot around the vaccine distribution strategies. We watch that potentially unfold, while at the same time, organizations having now lived through a really challenging economic environment, starting to think about what solutions within my mix deliver measurable economic and clinical value, and candidly, which ones don't. And the ones that don't, it is probably time to stop using them. And the ones that do deliver clinical and economic value, it's time to double down on those, because organizations have to find ways to save money heading into 2021 and into 2022, but probably need to do it without using sort of blunt instrument cost shifting strategies we've used in the past, because we've kind of put employees through the ringer for the left.
So you've put employees through the ringer. You're going to be the least popular guy on this panel, but
I think employers unintentionally have. I mean, I think they've done it with the best intent for their employees, but it's really hard to be a human right now, right? I mean, it's a difficult work environment. It's a difficult public health environment. As we were talking earlier, as we were prepping for this, right? The dynamics of, I was just having this debate with my brother and sister. I mean, not fully healthy 85-year-old father. How do we see him during the holidays without making him sick, knowing that, you can't just say, well, we'll see him next year. You don't know, right? And so those are really tough decisions that we're asking people to make. And so employers have to figure out how to support employees through that, while at the same time being good stewards of the resources of their organization in challenging economic.
Yeah. So Jason, Jim comes at this with a broad perspective. He's got lots of clients kind of across the spectrum. You're responsible for health and wellness for one of the largest companies in the world. Talk a little bit about Boeing. I think you've got 150,000 employees, and as an approach to health and wellness, how has that evolved? And really go back over the last decade, but then in particular, what's changed this year, and how do you react to what Jim said?
Yeah, so just to maybe share a few highlights. We at the Boeing company have, again, roughly 150,000 employees currently, but overall, we're insuring, close to 400 to 500,000 lives altogether when we factor in active employees and their dependents, as well as retirees and any, covered dependents that may fall with them. So, nearly a $3 billion annual healthcare spend, with 90% roughly of our workforce in the United States, the other 10% spread across 65 countries around the globe, serving 150 customers globally. So a lot of complexity, a lot of legacy, 100-year-plus old company that's been focused on innovation from day one. And that rings true with what we do on healthcare innovation. Over the last decade, we have witnessed and have been called, emailed, and basically, I would say during meetings at conferences, introduced and disrupted, just to have time with various healthcare innovators. And about 7 years ago, we knew there had to be a better way, not just with what we're trying to do strategically around healthcare, but also harnessing all this great ideation and innovation and bring it into a pipeline where we can more efficiently assess and figure out how we might be able to operationalize and implement some of these solutions. Livongo is a prime example of that. So through various channels, including Employer Health Innovation Roundtable, which was created by employers for employers to accelerate healthcare innovation, we've really leveraged, not just me, but many other Fortune 50, Fortune 100 jumbo employers to really orchestrate that pipeline of innovation from startups and innovators, and have a process by which we can effectively and efficiently assess over time on a routine basis what solutions might fit well with what our needs are. And I would characterize there's been 4 common theme pain points for employers overall that we've tried to address. Medical is one. When we think about the waste and the cost variability and quality variability in the U.S. healthcare system, we know we can do better around medical, and there's many solutions that cater to that. When we think about pharmacy, again, high trajectory on pricing. When we look at the migration towards specialty drugs, and how do we rein in the waste and the costs and sometimes the egregious pricing that goes with that, and have a sustainable, predictable, affordable model, for the future. Third is data analytics. And when we think about data, how can we optimize everything we do from a data-driven, predictive standpoint as opposed to a reactive standpoint when we think about building and ideating and refining our strategy. And then fourth, as Jim kind of touched on with the pandemic, mental health, emotional well-being, so much opportunity there. But when we double click in the medical and we look at, clinical categories that are high cost drivers, such as diabetes and musculoskeletal and many other, comorbidities, chronic health conditions, we've really worked hard over the last 5, 6, 7 years to understand how we can have an opportunity to bring these types of innovative solutions forward, working in harmony and integrating with our existing benefit supply chain, which includes our health plan carriers, our PBMs, so that they're enablers and they're working together as partners, and we can have, at the end of the day, a very positive member experience, along with a better quality outcome, along with a better financial return on investment. As we look at where we're at this year with the pandemic, the good news is pre-pandemic, we had a well-oiled machine with a process to fully vet and understand these various solutions and innovators. And that has been very positive because we have had a head start on adopting and accelerating a lot of these novel solutions and made them ubiquitous in many ways to the market. I would say since, COVID hit early this year, what we've seen within and across my counterparts across Fortune 50 jumbo employers is an acceleration of these solutions like a Livongo and other solutions that are digital that can meet our people anytime, anywhere, in whatever preferred modality they may have. And that's resonating with our patient member experience. It's resonating with our health plan when we think about, the reality of closures of doctor offices and dentist offices and access issues. There's just a myriad of variables and considerations. So that has really, I would say, paved the way this year to where we're seeing a much greater utilization across the board on these digital solutions that can deliver a better member patient experience and ultimately better outcomes at a more affordable, model than perhaps what we've done in the past. And it's certainly given an alternative. And I think that will stay the course as we look ahead to the future. But there's a lot of work that goes in with all the assessing up front, and how do you kind of piece it all together so it's integrated and harmonized with your existing supply chain. Thank you.
So, Jason, there's about 17 things I'd like to dig in there, but maybe I'll just start with one or two to summarize, I guess, and also it echoes, I think, what Jim said, it sounds like from both of your vantage points, it's not like the pandemic has radically changed the strategies of employers vis-a-vis health solutions, but more accelerated the adoption of new solutions and new tools. Did I hear that correctly?
Yes, absolutely. And I think it's predicated on maybe three key areas, and I got two sets of three key areas. Anything I can do as an employer to simplify everything we do from the patient member experience, as well as mobilize everything we do so it can be accessible anywhere, anytime, and then globalize it. So let's look beyond just domestic US. How can we bring something around the globe to meet my people wherever they may be at, whether they live and work in another country or may travel to another country? How can we hit those three key points? So simplify, mobilize, and globalize. And then the other set of 3 points that are so important is really what I would call the 3 E's of the triple aim. And it's all about the experience. So that patient member experience, what's that journey? What's that workflow? How does everything go? How do we make it uber simple? What's the efficiency around the financial ROI, return on investment, as me as an employer, as a payer, but also for my people? How can we make solutions more affordable? And then thirdly, the effectiveness, and that all goes around quality. Quality is so critically important to everything we do. We need sound outcomes, evidence-based outcomes, value-based arrangements that can deliver that. So that's a great start when we think about what checks, the initial set of parameters for us to start to more seriously explore further with an innovator.
So Glenn, one of the things Jason talked about was he said something to the effect of he was getting bombarded by vendors or solution providers trying to sell him things. And so from your vantage point, having built Livongo with one of the primary channels is selling into employers, what does an innovative employer look like, and how do they make the ones who are able to make decisions to adopt solutions such as Livongo? What does that process look like, and how common is good versus they just don't really know and have the infrastructure in place to navigate?
Well, I think, first of all, Stephen, thanks for hosting this, and thanks for the work you're doing at Matter, because all of that innovation work, which was kind of arm's length, when the pandemic hit, all of a sudden it became fundamental to what we're doing. And so this ability, and Jason described it well, they had done a lot of the work. And I think you described it well, but it was there, and now all of a sudden everybody needed it and started to adopt it. So telehealth, as an example, was 3 to 8% in terms of adoption. And then lo and behold, the pandemic hits, and now all of a sudden it's 90%. In some cases, it was the only way you could get care. So we showed the country how quickly we can, when required, adopt change and how quickly we can innovate. And fortunately, the tools were there. And so thanks for a lot of the work you're doing. Relative to employers, look, Boeing has been terrific in 2 respects. One, they've been a leader in adopting innovation. Maybe that shouldn't be a surprise because their business is about innovation. That's what they do. But they have been a leader in trying out new services, adopting it, and holding all of those innovative companies to those standards of it has to be easy and a good experience for our employees. Number one, you have to show effectiveness and efficiency. Effectiveness in terms of outcomes and efficiency in terms of you got to do it for lower cost. So I think they've been great. What happens from the self-insured employers is, first and foremost, there are a number of leaders, and everyone looks to what's a Boeing doing, what's a Lowe's doing, what are the top folks in the industry doing, what are they adopting, how are they using it? And then they go to people like Jim and say, Jim, Does this make sense? How could we use it? Help us implement that. So that's been kind of the process. So if you can get, and at Livongo, we were fortunate to, have Jason, who, by the way, wasn't easy to deal with. He pushed us and he made us better. And that was a great thing. Along the way, maybe we didn't love it so much, but he made us better. And the same thing that Jim and his team, all those folks are helpful if you understand it that way to make you better. So now we're seeing a broader adoption across the board. I think you pointed out one problem, and that is everybody wanted innovation. And then we had all of this innovation. And so we had many people, Jason might even say it, but they said, okay, enough. Like we get hit by 5 companies a day, and every one of them says they'll save us so much that if I added it all up, it'd be more than we're spending, and help us manage it. So Jim and his team and the employee benefit consultants across the industry help. But we think at Livongo, part of what we understood was what both members were looking for and the large self-insured employers was a simpler way to do business, a platform that included that. So at Livongo, that started with saying, it's not just diabetes. 70% of the people with diabetes also have hypertension. So if you just solve one and you don't solve the other, the person still isn't that healthy. And if you do both, but they're from different companies, now all of a sudden you have 2 coaches and 2 apps, and healthcare has become more confusing, more complex, and more costly than it was 5 years ago. That's going in the wrong direction. So we said, can we put it all on one platform? So we combined diabetes, hypertension, weight management, and really importantly, and Jason called it out, mental and behavioral health. But then we found that we started getting calls in the middle of the night, and people would say, hey, can you help me with my sinus infection? We'd say, well, why are you calling us? And they'd say, well, 1, you're the only ones who'll pick up the phone in the middle of the night. 2, you're the only ones who actually have our back and have real solutions. And 3, and really importantly, we didn't know who else to call. And we didn't want to go to the ER. So as we started to understand that, we said, well, if we're here to focus on treating and helping the whole person take care of themselves, not taking care of them, empowering them to take care of themselves, we need some other solutions. We went out and started to talk to people with telehealth solutions. That's an obvious one because we can't write a prescription, but a doctor can. And so we started those conversations long before the pandemic. And we ran into Teladoc that happened to be not only the largest, but doing 10 million visits in other countries, and also much broader than just telehealth. And they were out there saying 60% of those 10 million visits are people with chronic conditions. So we need to get into chronic care. So that's how that came about. But it was really member and client driven by saying, give us one place to go to solve our problem. Don't make us assemble all of these wonderful companies, but don't make us do the work. And that's kind of the solution. So we see the future as a future of platforms. Microsoft Office didn't have any of the individual best apps, but people said, just make it easy. I want to check the box and get it. So if I need it, I have it. And I think healthcare is going in that direction.
Jim, Glenn talked about platforms, he said this kind of magic word. So, one of the things that we see certainly at Matter is that especially early stage companies, but even companies as they start to scale, most of them are focused pretty narrowly. And partly that's because they have deep expertise in some particular area. Partly it's because they don't have unlimited cash. And so they need to develop something and do something really well and prove that it can work before they can really go broad. And there's other factors, but the result is that if you look at all the novel digital health solutions that are kind of worth looking at, most of them are probably what you'd consider point solutions. And what Glenn is talking about is building a platform in response to what his customers were saying they were really looking for. So from your point of view, what are you seeing both on the solution side as well as the demand side from your clients when it comes to this issue of platforms versus, wow, that's a really terrific solution, I'd love to adopt it, but it's not a platform?
Yeah, great point. So I think a lot of that goes back to the first of Jason's, groupings of three, right, around simplifying. And so employers do want that simplified experience. Candidly, it's one reason why many employers are willing to buy point solution types of services through their health plan, right? Because it's an easier thing to manage as an organization. Folks like Jason don't have unlimited supply of benefits, staff, resource, time, and hours. And it's easier for the participant to navigate, right? So I think for a startup, for an early stage company, I think you almost have to follow the path that a firm like Livongo did, right? Where you start in a space, you get really, really good at something, but have a plan for how you're going to expand. In that early stage, I think what we're looking for is an organization's willingness to plug into somebody else's platform, right? So I think we're heading toward an environment where you're going to have sort of three types of digital innovators, right? You're going to have very, very targeted point solutions that solve a very specific need. For those organizations to be successful, they have to have a really crisp proof statement, right? You got to be worth my time to add another vendor to the mix, meaning you solve a thorny issue that's complicated and you do it really, really well, right? Other end of the spectrum are going to be organizations whose primary value proposition is the ability to aggregate and interconnect and share accumulated data. They may not be great at anything. They themselves may not deliver any clinical value, but they're a great aggregator. And then there'll be players in between, right? That are platforms that aggregate parts of the ecosystem, but maybe not every part of it, right? So, I think the journey that Glenn's organization is on from complex care management in a unique way to that plus, being part of a virtual care network allows you guys to have a bigger footprint, but it's not a all-encompassing footprint, right? There are elements of the health ecosystem you guys won't do, so you'll have to connect, right? So I think that's where organizations play out. It's really hard to imagine a startup coming out and jumping right into that middle bucket, right? And being really good at 5 or 6 things at the same time. I think, as you said, Stephen, that's sort of probably a recipe for a startup to collapse under its own weight. So you got to be a really, really good point solution with a plan to connect to other resources, or go build aggregation platforms that make it really seamless, really easy to connect into a wide variety of technologies.
I'm sure there are a lot of entrepreneurs who are watching this conversation right now. And so, Jim, if somebody's at the early stage, they've got a novel solution that where they can clearly, and we don't need to define that right now, but clearly create value, clearly improve health. They can provide demonstrable cost savings, but it's really narrow. It's one thing. Should they go knocking on the doors of employers? Should they just call you? Do you want to provide your phone number and you can get some phone calls after this? Should they go to the health plan? What's the role of the health plan here? How does this ecosystem work from your point of view? And then, Jason, I'd love your perspective, from Boeing's point of view, how the ecosystem fits together.
So I will say, Stephen, I spent a lot of time with a lot of startups, and to me, there are 3 key pieces to success, and a lot of them have only 2 of them, right? One is
everybody's
you have to have
3s today, by the way.
Yeah. I don't know why, but you have to have content expertise in whatever space you're going to tackle, and you have to have technology expertise, right? Pretty much that's sort of a given. The third piece is you actually have to understand the convoluted thing that is the U.S. healthcare system, right? And in particular, you have to understand who pays for what and when. And I find a lot of solutions that would come knocking on our door saying, can we talk to your clients? Or would come knocking on Jason's door saying, can we be offered to Boeing? Don't fully understand the role of the employer. So I think one of the recommendations I would make to startups would be to go spend time with groups like the employer, the EHIR that Jason is a part of, or the Business Group on Health has a Health Innovations Forum. It's a place where you can go as a startup to tell your story to employers who are interested in hearing your story and are going to give you feedback. So I think that's one thing I would absolutely think about as an organization that's thinking about getting into this space. I think you really have to think about, is my solution a fit for the delivery system? So do I go knocking on the doors of large physician groups or hospitals? Is it something that ought to help empower another already established digital solution? So do I go knocking on Glenn's door? Or is it something I want to pitch to employers, right? The challenge with the employer marketplace is employers don't all act the same. So it's a difficult, Glenn, you can certainly attest to this, right? It's a difficult one by one sale, right? Jason's buying criteria will be different than the next employer and the next employer. So it just is a little bit challenging to start with the employer space.
And, Jason, what do you?
Steven,
yeah, Glenn, go ahead.
Add one other point to that. I agree 100% with what Jim was saying. I just add one other point. The pharmacy benefit managers, or PBMs, have also become product distributors, if you will. So rather than in the earlier days, maybe Livongo was a little bit luckier, maybe our product was that unique, but they were exclusively pushing our product and offering our product. And now what they're doing is they're saying to people, we will make it easier for you to buy these products. We'll assure their security, their privacy, and we'll help do the distribution. We'll even do the contracting. You can do an addendum. And that solves Jim's third problem, which I actually think is one of also of understanding and of finding how you're going to get it distributed. Because in a large organization, if you go to an organization like a Boeing or like a bank, you could be tied up 9 months in security just to get access into their system to offer it. And that's not good news for a startup. So getting a partner to help you distribute, that could be a large health plan or that could be a PBM. But the PBMs have taken on that role and helped a lot of smaller startups. And then you go back to Jim's first and second principles, which is you got to be really good at what you do. And you have to be able to, as Jason was saying, prove that it works, improving care, and that it saves money or at least doesn't cost money. But I would just add the PBMs to the mix.
Yeah, and for any PBMs who are also watching, I did not mean to slight you. So thank you, Glenn, for that. So Jason, your perspective on kind of how the ecosystem works within Boeing and what the process looks like for, you get, sounds like pinged all the time by companies that by solution providers that are looking for an entree into Boeing. Is that the right path? Should they be knocking on Jim's door, Glenn's door, PBM, health plan? How does it work?
Yeah, on an annual basis, I'm looking at about 300 different innovators. And any given year, I might be selecting, awarding, implementing 1%. So maybe 3. And when I look at who rises to the top on that 1%, it goes back to those 2 sets of 3 key points that I shared earlier. But beyond that, when I look at my current state benefit supply chain, all the different vendors and partners that we work with, we have north of 60. So if you step back and think about it as a patient or member or employee experience, no one really wants 60 different mobile apps, right? So how do you harmonize that onto one platform and have a very simple, elegant way to make that easy and also keep the employees and their dependents informed and aware of the solutions that can add value to them. May not be today, but they may have a diagnosis next week or next month, and they have an easy way to get what they need on the go from a navigation standpoint. So that's very important as we think about how to take that burden off their back. When we think about, and Jim and Glenn absolutely touched on such a crucial point as an employer, the way we've looked at this over the last several years is I reached out to my largest vendor partners, which is our health plan, our PBM, which account for over 80% of our annual healthcare spend, as well as our benefits eligibility enrollment vendor, and really asked, and hopefully to a good extent influenced them to move forward with standing up a vertical that would allow me a portfolio of carbon ready now vendors that we could make available to our employees. And that has absolutely evolved across all three areas over the last 5-6 years. So that has really, I would say, accelerated our capability to avoid, on one hand, doing the direct contract, which is perfectly fine. We do it all the time, but it could take up to 1 full year just to work through all the contracting, the data info security reviews, versus doing a carve-in with my health plan, my PBM, or my benefits eligibility enrollment vendor, and literally turn that solution on in days, if not weeks, but less than 30 days in most cases. So it just creates a much quicker runway to accelerate these solutions. And it also has the multiplier effect for that vendor partner, that innovator, to potentially have access to the whole book of business for that PBM, for that health plan, or for that eligibility enrollment vendor. And I think, long term, it makes a lot of good business sense for those three parties, because they're essentially placing more hooks into my people over time with these solutions that are smartly concocted and weaved in and integrated into what they're doing from a disease care management solution standpoint, and everything they do from a data analytics standpoint. They can leverage that and harmonize that all in one to provide me greater value when we look at trends and really try to figure out what are going to be our top 3 priorities for next year, 2 years out, 3 years out, and how can we bring this all home, as opposed to maybe relying on separate, siloed, fragmented meetings and reports and dashboards from different vendors across the whole ecosystem. So those are some, I would say, developing trends in the last, 5 years that have, I would say, enabled us to do more and do better as far as delivering and optimize that member experience, which is core to everything we do. Because let's face it, if our people have a difficult time registering, utilizing, that whole experience is so important, because that's foundational. If we have a very simple, better experience than anything we have, done previously, we're going to see some sustained utilization and engagement over time. And that's the secret sauce with, really enabling our people to stay the course with these solutions that we bring forward to them. And that's what's really, paved the way with, Livongo and others that we've turned on in recent years, is a sustained engagement and utilization that is delivering, better outcomes on all fronts.
So let's dig into that concept a little bit, this concept of sustained and engaged utilization. And, historically, the notion of an employee wellness program, ranged, but it was something that most employers ended up implementing, and the utilization rates have been not terribly high. What are you seeing? And Jim, I'll start with you. What are you seeing now? Is there a move away from this kind of traditional wellness programs and more towards solutions that have a different level of sophistication, like Livongo as an example? Or is it these things that are in addition to those wellness programs? And what does the landscape look like there, and how much do these things need to talk to each other?
Well, I think so. I think the wellness industry has been sort of on the same journey we were just describing in terms of the overall digital health space, right? So you go back 5 or 10 years ago, employers had, Fitbits for everyone. We're going to have a steps challenge. Then eventually thought about things like, financial. We weren't calling it financial well-being at the time, but financial education programs. A whole bunch of stovepipe programs that were not connected. And with varying degrees of participation and really murky, if any, economic value. And so a lot of our clients took a step back from that and said, these programs are addressing problems that still exist in my population. So I wasn't down the wrong path, but I might have been playing my cards the wrong way. So how do I put the pieces together differently? Much more of a holistic, call it a well-being platform strategy, right? Where any one individual, based on their facts and circumstances, might be accessing, preventative well-being strategies in one area, like mental health, while accessing through that platform more immediate care management through a product like Livongo, right? So, we used to sort of bifurcate. I had healthy people and I had wellness programs for them. And then I had my sick people and I needed care management programs for them. And in reality, everyone that's sick needs well-being, and everyone that's well likely has a pathway to some care management need in their future, right? So it's really about how those pieces come together in a platform. And I think it's also about probably less about sort of medical ROI or medical spend ROI in the well-being arena, and much more about, can you improve engagement and stickiness with your programs through well-being. I can get people excited to use an app. And if in the course of doing so, they learn that there's a diabetes care management program, or they learn that there's a digital mental health program available to them. Now I'm actually helping them manage real costly diseases, through the auspices of a well-being platform. So that's what we see the marketplace sort of migrating toward. So it's really about putting all the puzzle pieces together.
Glenn, at the risk of a question that starts to get a little esoteric, can you talk about the pricing strategy that Livongo went out with? Because it touches on this notion of, historically, there were wellness programs where employers paid per head. Essentially, anybody who's an employee, there's a price tag associated with you add another employee, whether they use the service or not, you're paying for it. And Livongo took a different approach. And I don't know if you can share that, and then let's also talk about, is this a trend that we're going to see?
Well, I'd love to, and I think it's really integrated in what Jim was saying, and that is that one of the reasons that wellness traditionally didn't work was employers didn't like it because you paid for everybody, and sometimes nobody used it, and you still paid. And as having run companies with thousands and thousands of employees, that never felt good. So we took a different route at Livongo, but there was also another word, and I always take issue with it, and that's engagement. And if you think about engagement, you're convincing someone to get engaged. And when I moved out from Chicago to Silicon Valley, I did it because I wanted to understand what was different there. And if you think about all of the services we love, not one of them has training, not one of them has engagement. They don't try to bribe us to use it or convince us. We just use it. We use Airbnb. We use Google every day. They didn't require training. We used Uber and we adopted that, so every one of these things, and there was a very different mindset, and that was you built value. So what we tried to do was not engage people, but empower them, put them back in charge, because healthcare happens to us. We're told what to do. And even the way we answer the phone at Livongo, instead of saying, can I help you? Because if I say, can I help you? What that means is you're helpless and I have the answers. And that's the way healthcare works today. Instead, we say, what do you need? If I say, what do you need? There's only one person who can answer it, and it's you, Steven. And so that whole mindset of changing that, well, that's really dangerous, because if you don't do a good job, people don't pay you. But so when we went in and we said to employers, hey, we're going to try this new thing, we'll only charge you if somebody uses it, and we'll only charge you if they keep using it. Well, that was very novel, and it was pretty scary. And even some of our board members said, well, what if they stop using it? And we said, well, we have a problem. So we have to be incredibly focused on the member, and we have to be incredibly focused on delivering measurable value, whether it's clinical or financial. And that's what really changed things. So I think the best companies will go there. Now, what we're seeing is there's some large players who have come back and said, well, that stuff's good, but we want to go back to the old way, which they're now kind of calling, well, we have a new pricing methodology. And that's, we're going to charge everybody, but charge you less. You know, that is absolutely counter to what we've tried to learn in healthcare. And that is, if you're consumer focused, nobody says, well, go to the Gap, and if you don't buy trousers or a shirt, you still get charged. We would look at them like they were from another planet. But we have people out there who are saying, pay for everything, and if you don't use it, and that just doesn't work. So we think this was fundamental to reimagining how healthcare could exist, which was you pay for value. And I think that's where we're going to go across healthcare. And I think if I take a further step, I think in the future, and this will be, I'll get in a lot of trouble for saying this, and Jason will remind me of it for whatever my next company is. And I think what's going to happen is people are going to say, I'll tell you what, we'll provide the product, and if it doesn't deliver measurable value, we won't charge you for it. Not this crazy, well, we'll give you a percentage of the product price for risk. We'll simply say, we'll go at risk. Use it, and if you don't like it and it doesn't add value, we won't charge you for it. That is scary. That's really scary, but that's how it ought to work. And if we can get there in healthcare, then we'll have fixed healthcare. And until we get there, we won't do it. But we've got to get to a point where we have measurable value, and we don't charge our employer or self-insured employers unless we can deliver the value. We don't say pay us, and if it doesn't work, we'll give you 10% of what you paid us back. That's a bad deal. We don't say, here's a drug, pay for the drug, but if it doesn't work, well, you still paid for it. Bad deal. So we've got to flip that. And that's going to be tough. That's going to be tough, but that's what we have to do. And people like Jason and Jim will help us drive that forward by banging the table and insisting, well, if it's that good, then stand by it, stand behind it. And that'll change healthcare.
Jason, you said you have 60 solutions that are part of the Boeing ecosystem. How many of those have a pricing model that depends on utilization? Do any of them have a model along the lines of what Glenn just described, where unless it creates some demonstrable value, you don't pay anything? And how much of them are, essentially a per employee per month?
I'm even curious to hear this one.
Yeah, no, this has been the big pivot when we think about the last 5-6 years. Employers in general are seeking pricing models that are predicated on value, right? We want to ensure that every dollar we're investing in any solution, we're getting at least that same dollar back, preferably more, 2 to 4 to 6x or greater back in return. That provides compelling value. And, it's I would say been a mixed bag, where traditionally we saw, whether as an EAP vendor or most other vendors, we typically saw per member per month or per employee per month pricing model. That's just, traditionally been, the way most of it has played out in past years. But when you dig into the data and you look at what the actual utilization is, and Glenn and Jim kind of hit on this point, we saw low to mid at best single-digit utilization for the likes of an EAP vendor. Yet many employers were paying a per member per month fee. And that was a huge cash revenue generator for those types of vendors that had an EAP solution that they were marketing and selling and providing to employers for many years, decades. And what we're seeing is a disruption with all these pricing models that are, I would say, archaic and outdated and just don't really make sense. So when you think about a per active participant per month pricing model, or you think about a per use basis, you're paying, fair and reasonable value for that patient member experience. And, we try to aim to have, I would say, financial guarantees, performance guarantees, in some cases, trend guarantees, not just financially, but also patient experience. Because, whether it's Net Promoter Score, we want to demonstrate over time that we have a better outcome, all things considered, financially and clinical quality wise, than what we were doing before. Otherwise, is just not going to be sustainable for us as a payer. And at the end of the day, the employers are the ultimate payers. Let's face it, when we look at the RAND data, we're paying 247% of Medicare rates. Huge difference. And when we look at, the over 155 million Americans that are under employer funded, subsidized, health insurance, huge opportunity. So you really opened it up perfectly, Stephen, when you said that employers are health insurance companies because of the significant spend and implications that we have. And I think that's been for far too long the missed opportunity for many innovators is not leveraging that employer channel. We clearly have, systems and models in place that help facilitate that, as we talked about, but the pricing model has absolutely shifted towards a focus on value. And typically what I see with most, if not all, innovator models is a pricing model that has, I would say, followed to a great extent what we've seen on a per active participant per month pricing model, or something like that is going to be a better value for the employer than, just hoping that people utilize a product and you're paying a flat fee regardless.
So I won't push you hard to provide an answer on what percentage of the 60 solutions have which pricing models, but I will ask, do you see you're meeting with companies all the time who are trying to sell you solutions. Are most of them who are calling you up these days pitching you on something that's looks more like Livongo's pricing model, more like historical, or something else?
What's been compelling is it's in many cases we're seeing more that are proposing models that are risk-free, financial risk-free to me as an employer. So at a minimum, I will not lose money with the solution, no matter how we construct the pricing model out, whether it's a per active participant per month that quantifies the outcomes and proves out the return on investment, or if it's some other pricing model, the innovator is going at risk. And that's essentially what we've been working through with many direct contracting efforts as well over the years with other established medical systems. When we think about ACOs, is we want to pivot away from that traditional fee-for-service mindset to a value-based arrangement. And generally, most innovators are willing to go all in, bear risk, to prove out that they can deliver, in most cases, a multiple of a 1-to-1 ROI guarantee. So when you think about that as a payer, as an employer, the natural question is, why would I even want to go through the hassle of bringing something forward if I don't know for a fact that I'm going to get at least a full return on my investment? And, how you orchestrate that out based on the nature of the solution may vary slightly, but that's, I would say, the foundation to, get started, so that we're not going to invest in a solution that's going to be costly and not yield the type of return that we normally would expect to see.
Steve, two quick things I would just add to that dialogue. One is for organizations that are self-insured but smaller in size and scale than a Boeing, it may be difficult for a point solution to demonstrate with sort of actuarial credibility that it adds true value on behalf of that employer. And if you've got multiple point solutions in your ecosystem, a healthier diabetic is going to be, there's going to be 4 or 5 vendors laying claim to that. So one of the things we've had some success with some of our clients is negotiating that sort of return on investment performance guarantee across the vendors, right? So essentially saying, hey, at the end of the day, you 5 vendors working together have to deliver an outcome of X, right? And at the end of the day, deciding who really drove that is kind of hard. So you're all on the hook together, right? So that's one strategy to consider in an environment where you've got multiple players in your ecosystem. The other is you're starting to see, and we're a player in this in full disclosure, and others are doing this as well, organizations that are sort of doing deep actuarial validation of startups on their book of business. So that when an employer that sort of kind of can't afford on their own to try and have an ROI model relevant to their population, they can at least select a vendor that has gone through that level of third-party rigor, if you will, in evaluating the model at large. It's not a guarantee that it's going to work for your population, but at least you're picking a vendor that has gone through a pretty rigorous third-party evaluation as opposed to just their own savings model.
Jim, I would love to dig in more around that actuarial validation. And there's a lot of questions from the audience that I didn't have an opportunity to ask, but we've hit the wire. So, so thank you so much for a terrific conversation and for sharing your expertise. And thanks so much to Livongo for working with us to produce this program and put it together. And thank you everyone for joining us. Stay tuned. Our next program in this series will be in January. We'll be sending out information about that shortly. And with that, wish you a very healthy and well rest of your day.
Thanks, Stephen. Thanks, everybody.